Assalamualaikum and good morning everyone. My name is Nurul Isati binti Jamhari. My metric number is 263671. Today I want to inform you all about hyperhidrosis. Have any of you ever been so nervous and not comfortable that maybe you get a little shaky or perhaps you get a little sweaty? Well, some people think this feeling like normal, but have you ever imagined when you hang out with your best friend and you begin to sweat through your hands, armpit, feet, even your back? And there are some individuals that start sweating profusely, especially in awkward or nervous situation. Sometimes this individual can also start sweating for no reason at all. This situation, more person be more uncomfortable. Most people that experience that situation not aware that may actually have something called hyperhidrosis. According to the International Society of Hyperhidrosis, it's around 5% of the world population that 350 million people suffer from this condition, and I am one of those people. Hyperhidrosis is a medical condition in which person sweat excessively and unpredictable. Basically, people who suffer from hyperhidrosis have overactive sweat glands. And so today I'm going to tell you about 3 ways to overcome hyperhidrosis using antiperspirant. Second is antiperspirants, and the last way is surgery. Firstly, to overcome hyperhidrosis is using antiperspirant. Basically, the antiperspirant be the first treatment that a dermatologist recommended for those who suffer hyperhidrosis. This is because affordable and be more effective to apply as directed. The antiperspirant can apply on any part of the body, such as under arm, hand, feet, and the others. The antiperspirant works when on the skin. As you sweat, the antiperspirant will work by controlling or reducing the amount of the sweat that reach on the skin surface. This helps the body to stop producing so much sweat automatically. However, the antiperspirant have side effects where who apply this antiperspirant can develop burning sensation or irritated skin. But this side effect only can occur to certain people, and this situation depend on someone's skin. If the side effect often occur, be sure tell your dermatologist and changing how you use the antiperspirant. This is because can reduce the side effect. When regular antiperspirant fail to work, you can use a stronger antiperspirants to overcome the disease. The prescription strength antiperspirant containing aluminum chloride can help those people suffering from severe hyperhidrosis. And a stronger antiperspirant is like direct salt. This method works reasonably well for who have problem is excessive underarm sweating. It can using before bedtime in 7 in a row, then roughly once a week as maintenance medication. The aluminum chloride able to collect the sweat glands and block them to produce sweat. The main side effect with a prescription strength version of aluminum chloride is irritation, which can be sometimes but not always. So don't worry. So I think you all definitely want to know more about what other way to overcome hyperhidrosis. Second way to overcome hyperhidrosis is doing antiperspirants. Antiperspirants is a technique that uses electrical stimulation or the no sweat machine. It is easy and safe treatment that is done at a doctor's office or at home. Antiperspirants work with water to provide a light electrical current to the skin. This process requires hyperhidrosis sufferer to immerse their hand or feet in a shallow machine for 20 or 30 minutes. The skin will thicken into microscopic, and this condition prevents sweat from reaching the surface of the skin. At the beginning of your treatment, you can use 2 or 3 times a week. When medical results show improvements, you can repeat this treatment as needed to maintain. the result. The treatment is ideal for sweaty feet, hands, and we also can use at the underarms. This treatment has side effects such as dry skin, irritated skin, and discomfort during treatment. But you can change your treatment to avoid this side effect. And iontophoresis was introduced over 15 years ago to treat excessive sweating. According to the International Hyperhidrosis Society, one study found that the iontophoresis had 91% of patients with excessive sweating. And another study found that the hyperhidrosis reduced of hyperhidrosis by 91%. The last way is doing surgery. To overcome hyperhidrosis, surgery is permanent and has a high risk. For example, ETS. ETS is most often used to treat severe hyperhidrosis. ETS surgery is performed by the surgeon. The surgeon will give patient a general anesthesia before the ETS surgery will be start. And the surgeon will be insert an Y-shaped endoscope into the lung space through a scar under the armpit. And then the certain nerve will be cut off by the surgeon with the help of a surgical mini camera. After the weight is stitched, the surgery will be performed into the next line using the same procedure. And a serious side effect can still occur. For certain people who suffer hyperhidrosis, cause them to sweat more heavily than did before. And other possible side effects can be extreme low blood pressure and irregular heartbeat and inability to tolerate heat. And another treatment can stop excessive sweating is surgical remove sweat glands. Basically, surgical remove of sweat glands is used to treat the underarms, and there are various techniques used by surgeon to remove sweat glands, and like extension, cut off a sweat glands, and lip suction, remove the suction and carriage, scrape out, and laser surgery, vaporize. However, the permanent side effect still can occur, like a scarring in surface of the skin. In conclusion, we can see that the current treatment to overcome hyperhidrosis are using antiperspirant, iontophoresis, and doing surgery. Like I said earlier, 350 million people are affected by this condition. So you maybe even know somebody who has this but never told you due to the embarrassment it can cause. Therefore, the next time you shake somebody's hand or see somebody with sweat on their shirts, just remember this speech, because there are no cure for it actually. What can I tell you? Without a cure, understanding is the next best thing. Thank you.